Hi, everyone. Welcome to the 100 Plus Remote Patient Monitoring 101 webinar. David Sloan, our Director of Sales, and Tom Wetterston, a Senior Account Executive at 100 Plus, are going to walk through some of the fundamentals of remote patient monitoring. Throughout the webinar, please type your questions into the chat, and we'll make sure to answer them at the end of the session. I'm going to hand the reins over to them so we can get started.
Hey everyone, this is Dave. As I mentioned, I head up the sales team over here. Obviously, work closely with Tom, who's one of our most senior and tenured account executives on the team. So really excited for all of you to join us here today. And I'll hand it over to Tom and let him talk about RPM.
All right. Hello, everybody. Thank you so much for joining us. I'm really looking forward to walking through this and giving you guys a lot of information on remote patient monitoring. To give you a quick overview, there's going to be three main sections to my presentation. In the first one, I'm going to go into the specifics on Medicare's reimbursements, walk you guys through the CPT codes, how they function, and what Medicare's reimbursements look like. And then I'll talk a little bit about our devices and what vitals they're designed to track. And then finally, I'm actually going to hop into the software a little bit, click around for you guys, and genuinely give you an idea of how this really works for providers and what using this would look like for you guys for your day-to-day life. Without further ado, let me go ahead and get started. Now, the first thing I'm going to do is do a little background on remote patient monitoring. And right off the bat, the main thing that I always say is that the technology that allows this program to work isn't anything groundbreaking or brand new. It's not as if 1 year ago somebody came up with an incredible invention that has allowed remote monitoring to actually work. In fact, the technology has been around for a long time. And as you probably know, people have talked about the merits of remote monitoring for some time now. The two things that have happened recently that have a lot of energy behind this and have a lot of people really excited about it is about 1 year ago, Medicare started formally reimbursing providers for their time spent remotely monitoring patients. They put 4 CPT codes in place that are really robust, and they created a real revenue opportunity for practices and for providers. The other thing that's happened, which has put a lot of energy behind this, and a lot of you are probably guessing what I'm going to say, is the pandemic. Now, that's caused people to reevaluate the way that they do a lot of things, one of which is how they administer medicine. A lot of Medicare patients are a lot less mobile than they were 8 or 9 months ago. And so those two things combined have put a lot of energy behind this program, have created some very real benefits for patients, and have created a very real revenue opportunity for practices and for providers. I'm going to talk a little bit about that revenue opportunity. And like I said, I'm going to walk through these CPT codes one by one and describe how they work in a little bit more detail. Now, there are 4 main CPT codes that providers are able to bill Medicare for RPM. And the amount to which providers are reimbursed will vary slightly based on their locality or based on where they're located in the country. All of the values that we're looking at here on the right, these are all calculated off of the zip code of 100 Plus's home office. That's in San Francisco, and that zip code is 94107. If you guys would like me to crunch the numbers for your location specifically, simply let us know after this webinar and I'll be happy to do that for you. I'm going to use these values to explain the general structure though. Now, the first of these CPT codes is 99453. Think of this as like a one-time setup. Every time a provider enrolls a patient into their remote monitoring program, that provider will be eligible to send one claim to Medicare for 99453. Next is 99457. Now this code is recurring. So this is monthly per patient, and this covers the literal time that providers spend reviewing patient data and communicating with patients in regards to that data. In order for a provider to be eligible to bill Medicare for 99457 for a specific patient in a specific month, that provider just needs to hit 20 minutes of review and communication. Now that 20 minutes can break up any way you like. There's no golden ratio. It could be 2 minutes of reviewing data in an 18-minute conversation with a patient or vice versa. It could be spread out over 5 2-minute conversations with a patient and 10 minutes of review. Basically, there's no specific way that 20 minutes needs to be chopped up. Just so long as you hit 20 minutes for a certain patient in a certain month, you're eligible to send a claim to Medicare for 99457. In the event that you actually spend up doing more than 20 minutes of review and communication for a certain patient in a month, you can use this code, which is called 99458. This is kind of like an extension code that works off of 99457, and for all intents and purposes, it functions in the exact same way. This code covers an additional 40 minutes of review, broken up into two 20-minute increments. So the total cap for a certain patient in a month is 60 minutes, the first 20 being attributed to 457, and the remaining 40 being attributed to 458. And last but not least, we have 99454. So like 457, this is also a monthly invoice per patient. And this code covers the literal devices and the services that provide them. Now, the great thing about this code is it makes remote patient monitoring genuinely an economically viable option for providers. And the way that 100 Plus works out is we'll ask that whatever amount you're reimbursed by Medicare for 99454, not a penny more, not a penny less, whatever amount that is, we'll ask you to send that to us. And that'll represent our only service fee. And that covers everything that we do and everything that a provider needs to remotely monitor patients, whether it's the devices, the software, or support for you and support for your patients, not only as you're getting the program going, but throughout your relationship with us. Now, the number that I really counsel providers to look at and to pay attention to is what their ending yearly net revenue will be after billing Medicare for these codes. That is, after 12 months, if I'm remotely monitoring, say, 50 patients, how much revenue can I really expect to come back and to go into my practice? And what that number is going to be will vary slightly, not only based on how many patients you end up enrolling, but also based on your zip code and your area in the country. Here we're looking at a table that projects the revenue for a certain amount of patients for a practice. And one thing that you'll probably notice right off the bat is how well this program scales. If we have, say, 50 patients on the program, and we're sending claims to Medicare for these CPT codes, we can expect our ending yearly net revenue to be over $105,000. If we say advance to 800 patients on the program, then all of a sudden our ending yearly net revenue is closer to $1.7 million. Now, one thing that's important about 100 Plus for me to point out is we don't have any type of minimums or specific patient totals that a provider would need to enroll. We have some providers who have 2 patients on the program, and we have some providers who have over 1,000 patients on the program. That's really up to you guys. But this gives you a good idea of the revenue opportunity that's available and how well this program scales over time and over a patient base. I'd say this slide is where I commonly receive the most questions. Like Dave and Liz mentioned, we will do a Q&A at the end. So if you do have questions on this, please feel free to shoot them over in our Q&A line. And if you do want to specifically crunch the numbers for your practice and talk to me about it in a little bit more detail, let us know afterwards and we can schedule some time. I'll go ahead and move on for now. I really just explained how RPM is a great option for providers. Here's why the providers that use 100 Plus feel like 100 Plus is a good option for RPM. And there are really 3 main things to call out here. I think they're the 3 most important things for providers. The first one is that we won't ask you for any money down or any type of down payment as you're starting your program. Even if you wanted to ship 200 or 300 devices out to patients tomorrow, we won't ask you to put any money down with us before we do that. That's really great because obviously we don't want there to be a huge financial burden on providers as they're getting started with the program. The other really great thing about this is you will literally realize revenue right away in month 1 as you start to build these codes. So that's really the first reason why 100 Plus, to me, is a great option and why the providers who use us chose us. The next thing that really sets us apart is we handle all of the logistics that surround enrolling patients and getting the program started. So aside from startup costs, there's also a lot of logistical work that goes into getting this off the ground, whether it's making a patient list in your EMR, or doing a eligibility checker to make sure that patients can be on the program, reaching out to patients and doing patient education, and then simple stuff like pairing devices to patients and shipping them out to patients at their residence. 100 Plus handles every phase of that. And the best thing is we don't have any additional fee or cost for doing so. And this is really great because, and I really mean this when I say it, healthcare providers are as busy as any other people on the planet. And you guys don't exactly have 14 or 20 hours to hit pause in a week and do the work that surrounds getting a program like this off the ground. So quite literally, if you would like to give us a list of patients, have us do all the work around onboarding them, and simply let you know when they're using devices and their data is going to the portal, then that's totally fine. We'll handle all of the work around enrollment for you. Now, last but not least, our system will read every single vital that is taken from every device from every patient. And it will look and see if those readings are abnormal or if they're severely out of range. One reason why we do that is so that if someone does, say, take their blood pressure and it's spiked and they're really hypertensive, we'll be able to send an alert to the provider via email to let them know. And that way the provider can act in real time to try to reduce the odds of or completely avoid an episodic event. If we do that, then we can reduce hospitalizations and thus reduce costs. The other reason why our system will take readings and send alerts out to providers to let them know if those readings are abnormal is that we don't want you to feel like this program is going to completely overload you, change your day-to-day workflow, and change your day-to-day work life. We don't want you to feel like you need to have this portal open 24 hours a day, and we don't want you to feel like you need to watch it like a hawk. So if a reading is outside of ADA or AHA ranges, if someone's blood pressure has spiked, or if someone's blood sugar is abnormal, the system will pick up on that. It'll send an email alert out to you, and it'll let you know. Those are the reasons why I really feel like 100 Plus is a great option. And after working closely with a lot of our providers, I know that those are the main reasons why they chose to go with 100 Plus. Now I'm going to talk a little bit about our devices. The main thing to cover with our devices is they're all powered by SIM cards. Another way of saying that is that they're all cellular enabled. The SIM cards are what allow the devices to take patient readings and then to ultimately send those readings online to a portal where you can log in and review them. Now, the great reason and the great part of having SIM cards in those devices is that means that the devices require zero setup for the patient. And when I say zero setup for the patient, I truly mean it. Patients won't need to have a Wi-Fi connection. They don't need to have an updated smartphone or any smartphone at all. They don't need to download an app. They don't need to make a username and a password. And they don't need to do any type of Bluetooth pairing. Now, this may seem like a small thing, but it's really important. And you're probably guessing the reason why. You can picture that average Medicare patient. They might not be super tech savvy, and they might not be really gung-ho about using technology or having to pair a Bluetooth device on a daily basis. This can end up being a really big barrier to compliance and an impediment to them ultimately using the devices a lot and the program performing its function. So because we have SIM cards in there, when we ship these devices out to patients, they're already paired to that specific patient and provisioned and ready to go. So all a patient would have to do is open up the box, take the device out of that box, hit the start button, and it's ready to use. I'll use a personal example from my life. My father is 66. He has been on Medicare for 1 year. I absolutely love him to death. He's not the most tech savvy guy in the world, and he gets frustrated really easily. We tried to get him to use 3 blood pressure cuffs on a regular basis for about 15 years, and the same problem would come up every time. There'd be some issue with the technology. He wouldn't know how to pair it. At one point, he had an app that he forgot how to download into, log into. It ultimately, every time, just became a huge headache for him, and he never ended up using those devices for any more than 3 weeks. The fact that we have SIM cards in here completely sidesteps that problem. It's a really important thing. So this is our blood pressure cuff. It'll take 60 seconds to take a patient's reading, And then once it has, it'll automatically take that reading and it'll send it to the online portal already paired up with the patient's name. This is our glucometer. This functions in the exact same way. One really cool thing to point out here that personally I take a ton of pride in is that we actually do free strips and lancets for all patients who are on 100 plus. When we initially ship these out, we'll include enough strips for 2 usages per day for 2 months. However, if and when patients do run out, and obviously they will, they can reach back out to us directly and they can request more strips and lancets, and we have no limit on that. So we encourage you to encourage patients to take advantage of that. And then finally, we have our digital weight scale. This is capped at 440 pounds, and it'll function in the exact same way as the other 2 devices. One thing to point out here on these 3 devices is that the service fee for 100 plus does not change based on how many devices a patient has. So if you feel like a patient could benefit from having a scale, a cuff, and a glucometer, then let us know and we'll ship all 3 out to the patient. It's not going to cost you 3 times as much. So those are the 3 devices that we have out now, but we also have some really good stuff in the works. This is what we call a COVID kit, and we're taking pre-orders for this right now. This is a digital thermometer and a pulse oximeter. These are also going to use SIM cards, and these are really designed to help seniors combat COVID and help providers keep a closer eye on some of their vitals during this time. And then later this year, we're also coming out with what we call a smart hub and a wellness kit. Now, the wellness kit is going to be these 4 devices that you can see at the bottom shipped out together. And they're also going to come with this smart hub, which is going to be pre-configured. And it's going to allow these devices to all loop through this hub and communicate with the online portal. And then finally, we're also coming out with what we call a heart watch. The 2 main functions of this heart watch are going to be to detect when a patient goes into cardiac arrest or when a patient falls down on the ground, and then to immediately alert emergency services without the patient having to take any type of action, like pressing a button. This watch is also going to track activity for a post-surgery or a weight management scenario, and this is going to be out in Q4 of this year. And then last but not least, we're also working on what we call a medical home. This is going to be a video hub that's specifically designed for telemedicine visits. Now I'm going to talk a little bit about our online portal. So that's the software that the provider literally uses. That's where a provider would log in if they wanted to take a look at any phase of their RPM program, whether it's a billing claim for a certain CPT code or the blood pressure of a certain patient. Everything will live in this online portal. That portal is cloud-based. So you'll log into that from any computer, from any smartphone that has an internet connection, just like a Gmail account. And this portal is where you're going to be routed to when you receive one of the patient alerts that I mentioned earlier. That would be an alert that would go out if a patient takes a reading that's abnormal. You'll see here on the left of the screen an example of what one of those alerts look like. They go out via email to any email address that you'd like to link up to it. And when I receive this, if I press this red View Patient Data button, that's going to prompt me to log into the online portal. Now we're going to walk through my personal demonstration portal. There's not going to be any live patient data in here. We don't want to violate any HIPAA laws, of course. This portal is exactly what the portal looks like for any real provider who has real patients in here. I'm going to click through this a little bit. And right now you can see that we're looking at the dashboard or the home page. This dashboard is, for all intents and purposes, the cockpit of the portal. You can navigate to any of the tabs here on the left through this page. The one that I'm going to spend the most time showing is this patient reporting tab. And this patient reporting tab is where you'll go to look at a specific patient's vitals. So this is where a provider is going to spend the most time. You'll see that I have a very small patient population. I just have one patient. Her name is Jane Doe, and she's been enrolled with me since the beginning of April. But you can imagine that for a provider who has 50 or 100 or 200 patients on the program, they'll have all of their patients listed down here. So if you ever want to just take a look at all the patients that you have in the program, you can hop into this patient reporting tab and you'll see a list of those patients. But at the top, you'll see that we'll give you a way to filter that list. So if we're searching for one patient specifically, we can type in that patient's name and find them. We can denote patients to certain physicians or certain providers. So if you say have a couple staff members who are specifically handling this program and doing the monitoring for patients, say you had 100 patients on the program, we could pair 50 of those patients to one staff member and 50 to another. That way a staff member could come in here, select their own name, and they would just see the certain patients that they're monitoring specifically listed there for them. And then finally, we have this filter that works off of RPM time. Now, in my opinion, this is the most underrated feature in our whole portal. The really cool thing about this is it's going to let me filter this list based on how much time I've already spent reviewing a certain patient's data and communicating with a patient about that data in a certain calendar month. So right now it's October. Let's imagine it was the 25th day of October. And so I just had about 5 days left in the month. Well, I might want to quickly pull up and take a look at the people who I haven't spent 20 minutes monitoring yet. Because as you'll remember, that first 20 minutes is the big threshold to be able to send a claim to Medicare for the CPT code 99457. So I want to make sure that I hit that 20-minute threshold wherever it's necessary so that I can send as many claims to Medicare as possible. So I can come in here and I can select 0 minutes. And that's going to pull for me right to the top of the list all the people that I haven't hit 20 minutes for yet. This is a really helpful tool when it's the last week or the last few days of the month, and you're trying to identify folks that you haven't spent a lot of time monitoring or communicating with yet. When I want to look at a certain patient's data, I'll just hover right over here and I'll click in. And this is going to take me to a page that houses all the data for all of that patient's devices for the entire length of time that they've been on the program. That's one thing about 100 Plus. We don't delete patients' readings. We archive everything so that you can look back over, say, 3 months, 6 months, or 18 months to try to identify trends over time, or if you just want to look at vitals from a time period in the past. Now you'll see here that right now we're looking at the weight chart for Jane Doe for the month of October. So these are all the weight readings that Jane Doe has taken so far in the month of October. And you'll see here that we have the information displayed in a graph-based format. If anyone out there is like me, then you absolutely hate graphs. It's just not a great way for your brain to intake information. I've always felt that way, which is why I'm really happy that this portal gives me the same information down here in a list-based format. Some people are really visual, some people are not. So we have both so that it's easiest for a provider. You'll see if I go down here a little bit more, I can actually toggle between the different devices. So many patients might use 2 or 3 devices. Right now we're looking at Jane Doe's weight, but we can click right here and we'll be able to take a look at her blood pressure readings for the same time period. Down here in our list, you'll notice that there are some color-coded sections. These color-coded sections denote how out of range or how in range a certain reading is. One thing to note is that the color coding red or pink, those are the readings that are abnormal and will ultimately trigger an alert to go out via email. Oop. And now we can switch here to blood sugar. And we'll see here that we're going to give you a reading of before meal and after meal. And we also have our list down here with color-coded readings. If I ever want to take this info quickly pull it out and either upload it into a hard drive, even email it out to a patient or a patient's family member. I can easily hit this small gear button, and with the click of a button, I can download this info into a PDF or into a CSV file. Here at the bottom, you'll see there's a small note-taking section. Anything that you put in this note-taking section, we archive and we can pull out for you at a later date if you need that for documentation or reporting purposes or for any reason, really. And you'll see here on the left that we also have some kind of pre-made comments. Now, this is so that you can easily leave a comment either for yourself or for someone else who might be logging in here and reviewing some time. And if you want to make your own pre-made comment here, you can do that. Finally, you'll see down here that there is this button that says submit and bill for 20+ minutes. Now, once you've spent 20 minutes reviewing a certain patient's data and communicating with that patient in a month, once you hit that magic 20-minute mark, you'll hit this red submit and bill for 20+ minutes button. And this is going to do two things. The first thing is it's going to create a claim over here on the left in this claims tab. This claims tab is basically like a monthly snapshot of all the claims that you're eligible to send to Medicare for a certain time in a calendar month. So if you ever just want to hop in here, take a look at that claims tab, you can get an overview of all the Medicare claims for RPM that you're currently eligible to send for a certain month. The other thing that this submit and bill for 20+ minutes button is going to do is it's going to initiate a claim notification email. And that'll be sent out to any email address that you hook up to this button. Typically, it's the email address of the biller, whether internal or external. If your biller, again, whether internal or external, wants to get a little bit more involved, and they actually want to be able to log into a portal and take a look at a claims tab themselves, then we can make a small portal similar to this for your biller. It'll look for all intents and purposes the exact same, but it won't include any of these sections which house sensitive patient data. And the last thing I'm going to walk through is this enrollments tab. Now, like I mentioned, 100+ does all the work on the front end around onboarding patients, and we handle all of logistics. However, if you're ever in the practice, say you're having a conversation with a patient, they mention that, hey, remote patient monitoring, I heard a lot about that. That sounds pretty great. I think I might want to be on the program. Here's how you would easily enroll a single patient. I'll hop in here and I'll hit create an enrollment request. Right off the bat, it's going to ask me for some pretty basic information: first name, last name, contact info, as well as Medicare Advantage or Medicare number. And then we're going to ask you to put in a mailing address for that patient so we know where to ship the devices out to. And finally, you'll walk through this patient agreement. To read out, this takes about 40 seconds. This essentially entails what it really means to be on the program for the patient. And this can be signed electronically, it can be signed in person, or it can be signed verbally. So I'm going to go ahead and hit pause. And I think it is a good time for us to start our Q&A. Before I do that, Dave, I'll kind of open up the floor to you. Was there anything else that you wanted to mention?
No, I feel like that was pretty thorough. I know we've got some questions here.
All right. Would you mind reading them out to me?
Yeah, Liz.
Yeah, so some of the questions we got, the first one was, can you bill any of these CPT codes under Medicare Part A?
Can you bill any of these CPT codes under Medicare Part A? I believe the answer to that is no, although I'll defer to you, Dave, if you know if there's a different answer.
No, that's correct. You need Part B or an Advantage plan.
Okay.
And the second question is, can you also bill to commercial insurance plans?
I believe the answer there is also no. At the present moment, in order for a patient to be rolled in 100+, they need to be either on original Medicare or a Medicare Advantage plan.
option to buy the device instead of paying for them on a monthly basis?
Good question. At the present moment, no, that is not an option.
And does 100 Plus integrate with eClinicalWorks EHR or any other EHRs?
Good question. We don't directly integrate with any EHRs right now. However, we are working on a few key integrations. And one thing we actually are really good about is for the providers who do use us, if they do want us to work on a specific feature or a specific integration with an EHR, they can let us know and we'll add it to our list and try to work on it as soon as we can.
And which of these CPT codes have patient copays?
Good question. Now, there is a patient copay associated with the CPT code 99454. Let me go back to that. That patient copay is associated with 99454. You'll see it down here. One of the things that I do on my demo is, in addition to calculating the exact Medicare reimbursements for these CPT codes for a specific location, is I'll also calculate the copay. What I see most commonly is that copay is anywhere from $8 to $15 per patient per month. And that copay, right now, Medicare has extended, as a lot of providers probably know, a lot of discretion around how aggressive you are with collecting that copay.
Thanks. And another question we got in was, does it automatically track time?
Great question. This is actually one thing that we discussed a lot internally. And ultimately, for the ease of the provider, we decided to make it so that the system does not automatically track time, and to have providers manually track time. And just for a little bit of context on that decision, we toyed with the idea of putting in a type of timer in here that would go tick, 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 and would track the amount of time that somebody spent in a portal. What we ultimately decided was that because we are also inundated these days by messages on our smartphone or emails on our computer, it would be too easy for a provider to hit start on that timer and then to have their attention taken to something else and to not hit stop. Then all of a sudden the timer would be ticking up and it would hit 20 minutes, and then we might be generating a claim over here for 20 minutes that wasn't spent monitoring. So long answer, we decided for the ease of the provider not to put a timer in here and to have providers manually track their time and usually keep track of it in this small note-taking section down here.
Yeah, best practice for that, quick initial time spent and a date so that you can look back over that. And then I see someone had a question regarding the copay and wanted to clarify that. There is a copay associated with all of the CPT codes. As Tom stated, through the end of this year, Medicare has left it up to the discretion of the practice on whether or not to collect. And we have not heard on how they will approach that in 2021. It would seemingly depend on what the second wave of COVID and the impact of that looks like.
Thanks, Dave. Another question we received was, how do you begin to enroll patients with white glove enrollment, and how do you get started with that?
Great question. So that'll really start with a call with our provider implementation manager. That person is really knowledgeable when it comes to EHR systems, building out patient lists, and then ultimately enrolling patients onto this program and getting them started. The only part that a provider would need to be on with that provider implementation manager for is simply making that initial patient list. Once we've created that patient list, our provider implementation manager will upload it into this portal, run it through an eligibility checker, and then ultimately enroll them into the program. We'll reach out to the patients and do education and consent, and then ship the devices out to patients. So the short answer would be, we'll schedule a 30-minute call with our provider implementation manager. On that call, they'll game plan the patient list with you, and then you kind of sit back and let us take care of the rest of the work.
Thanks. One more question we received was, is it possible to bill incident to a provider who is retired or is a volunteer caregiver?
Dave, I might defer to you on that one.
Can you repeat that question, Liz?
Yeah, is it possible to bill incident to a provider who's retired or is a volunteer caregiver in like a community-based setting?
I don't have
You may not.
I don't have a firm answer on that. My inclination would be no, but I'm not positive.
Okay. We've received a lot of questions about whether we'll be sending out the recording after the session, and we'll be emailing the recording after the webinar. And I think those were all the questions we had.
Okay, great. Well, I'm going to go ahead.
Last one I just saw pop up here was regarding does RPM billing cancel the ability to bill for chronic care management? The answer is no to that. The two pair quite nicely together, and we have a lot of practices utilizing both programs.
Yeah.
We just had one more question come in too. Is CPT code 99091 able to be billed with 100 plus?
The answer to that one is no. Now, you wouldn't necessarily not be able to bill Medicare for that certain CPT code if you were using 100 plus, but that code specifically, we wouldn't be generating claims in our portal for that code, and you wouldn't see that code mentioned anywhere in here.
We had another question come in. Are there any other billing capabilities like medication management with 100 plus?
Nothing in regards to medication management. However, Dave, I'll kind of open up the floor to you if you want to talk a little bit more about how billing is going to work going forward with 100 plus.
Yeah, we only manage billing related to remote patient monitoring specifically, and there's no plans currently to expand outside of that. It's not our sweet spot, if you will.
Thank you so much for answering those questions. I think those were all the questions that came in.
Absolutely, and I'll totally reiterate again, if more questions do come up, feel free to email us after this webinar. And if you do specifically want to look into it individually and ask some more questions that are specific to you, then please feel free to schedule some time with us. We're happy to do that. What I'm going to finish up with is actually walk. Oh, sorry.
If anyone would like us to reach out specifically to address any particular concerns, if you just want to bubble it up here in the chat, we'll be sure to reach out later today.
Yeah, and I'm going to finish off by actually showing you guys what it looks like to register for 100 plus through our website. It is a pretty quick process and it's really straightforward. The first thing I'm going to do is go to 100plus.com. And when I arrive there, I will see a button in the upper right-hand corner that's going to say sign up. When I tap that, right off the bat, it's going to ask me for some information. And then when I hit next, I already have a 100 plus account. Let's see. Next, it's going to ask me to put in some information about my practice specifically. And when I hit next here, it's actually going to take me to a page that lets me type in a number of patients and get a sense for the revenue that's involved. This will be similar to the slide that we went through earlier. And then the last thing I'll show you guys here is it's going to ask us to select which sample devices we'd like to be shipped. Oftentimes, providers will want a few sample devices in the office, whether to use for themselves or actually to show to patients who might be inquiring about the program. We're happy to ship samples out to you. Simply during your registration process here, select one of each sample device, and we'll get those shipped out. I will go ahead and leave it there, Dave. Hand it over to you if there's anything that you want to add or close up with.
Yeah, just thank you for everyone who attended today, as well as asked some questions. We always love having these and doing walkthroughs of the program and the platform and why providers find it useful. If there's any of you who would like us to specifically reach out to you, have a conversation regarding particulars related directly to your practice, please bubble up here in the chat, and we'll be in touch later today or first thing tomorrow. And again, thank you very much for your time.